Hello, welcome to News Decoder's webinar on how COVID-19 is affecting healthcare in the United States and in Africa. My name is Nelson Graves. I'm the founder of News Decoder, and I'm speaking to you from rural France, and I'll be your moderator today. And I'm joined on camera by my colleague, Lauren Huser in Toronto. Hello, Lauren. And by students at the African Leadership Academy in South Africa and students from the Hewitt School in the United States. Now, with no further ado, let's have the students themselves introduce themselves. So let's see, Maya, first, would you like to say who you are?
Yeah, hi everyone. I'm Maya. I'm from New York City, and today I'll be talking about healthcare, the healthcare system in the United States, the public health system in the United States, and really centering the conversation on its issues and the possible solutions to those issues.
Terrific, thank you, Maya. Domina.
Hi everyone, my name is Domina Amara and I'm from Tanzania. I'm currently schooling at African Leadership Academy. I'm a year one student and I'll be talking about the impact of COVID-19 on local education systems in South Africa.
Terrific, thank you. And next, Hannah.
Hi, I'm Hannah Rahman. I go to the Hewitt School in New York City. Today I'll be discussing the impact of COVID-19 on hospitals, and I'll be discussing some geographical and racial disparities with COVID-19.
Thank you, Hannah. Clifford?
Hi everyone, I'm Clifford and I'm from Sierra Leone. Today I'll be discussing about the impact of COVID-19 on social workers and healthcare workers in the Gauteng province of South Africa.
Thank you very much. Sadie?
Hi, my name is Sadie. I'm a senior and I'm from Manhattan, and I will be presenting / discussing a photojournal focused on providing a visual representation of the physical change.
And you'll be presumably sharing your screen, Sadie, is that it, to show the photos?
Yeah, and I'm gonna also be discussing partially more, a little bit.
Okay, terrific, okay. Joel?
Hi, my name is Joel Ayomide Adejola, and I'm from Nigeria. I'm a year one student at African Leadership Academy. Today, I would be examining the effects of COVID-19 on employment and productivity within the mining sector in South Africa.
Thank you, Joel. And last but not least, Erin.
Hi, I'm Erin. I go to the Hewitt School in New York City, and today I will be presenting on the impacts of COVID-19 amongst the incarcerated and the incarceration system.
Thank you, Erin. Lauren, we have a message in chat saying that there seems to be some sort of, yeah, so you've seen it, okay, some sort of limit at this point, which we don't want. This, by the way, this could be a record attendance for a News Decoder webinar, which is absolutely fantastic. So thank you for those introduction, students. Our panelists, as I said, will be examining various ways that COVID-19 is impacting the healthcare systems in their communities and the people who rely on it. Now, each student will have up to 3 minutes to summarize their research and reporting, followed by up to 4 minutes of questions and answers. Now, I'd like to say just a bit of very important housekeeping. We like these sessions to be interactive. And if you're off camera and you want to ask a question, you can ask a question at any time. Now, to do so, please use the Q&A function to ask your question. As you'll see, you have the possibility of voting for questions that you consider to be the most important. That helps push the most pertinent questions to the front of the queue. You can, of course, use the chat function any time, but for questions, please use the Q&A function. Now, the session will last for 1 hour, and we're recording it for those who cannot be with us today during the live session. And with that, let's get going. And Maya, you're first up. Over to you.
Great, okay, so I'm going to be sharing my screen because I have a presentation. Sorry, 1 second. Okay, can everyone see that?
Yes.
Okay, great. So I'll introduce myself again. I'm Maya. I will be discussing the faults in the current United States healthcare system and also its possible solutions. So there are 4 main issues regarding the US healthcare system that have been either exacerbated or revealed by the coronavirus pandemic. The first is health insurance coverage. So since the majority of people in the United States get health insurance from their employer. As employment rates went down, the number of people without coverage increased. The second is the financial loss for healthcare providers. So most non-COVID related services that healthcare institutions provide were not used or needed during the peak of the pandemic, and thus those institutions were generating little revenue. And then the third is the huge issue of an underfinanced public health system and the subsequent issues that emerge as a result. Those being the late implementations of social distancing guidelines, failed contact tracing, many, many more. And then the final issue is of the racial, economic, and geographic disparities in COVID infection, death, and response rates. And by response rates, we mean the vaccine rollout, testing, and other related health measures. To ameliorate those four issues, public health policy experts, including Dr. Vassan of Columbia University, who I spoke to, are calling for a drastic change in the distribution of money and an emphasis on the expansion of the public health sector. So theoretically, this will minimize the disparities and ensure that we're better prepared for the next pandemic or public health crisis. And to do so, according to Dr. Vassan, we need to shift the conversation and really invest in public health, meaning investing in public health departments, developing community health workforces, and situating public health in the public policy conversation. It's also important to act in line with the social determinants of health, which consist of the economic and social conditions totally apart from the healthcare system that influence a person's health status. And if we can do so successfully, we can reduce the impact of disparities even further. So to ensure that these large, really conceptual ideas are firmly planted in the functioning of the healthcare system, the federal government should try to regulate the economic incentives that keep the current system stagnant. And in conclusion, Dr. Vassan hopes that, quote, COVID-19 has given young people the opportunity to see how healthcare can become a much more principal and central part of how we plan our society and protect people.
Wow, that was right on time. Very well done. Very well done.
I can take
very
any
well
questions
timed.
now.
Yes, I'm sure there are. I have some, but I'm not, I shouldn't be first up. Other students on the panel, any questions? And then of course, people off camera, please use the Q&A if you have a question. So over to the students on camera. Do you have any questions of Maya? I do. Maya, I was wondering, does this make the likelihood, or does COVID and its impact make it more likely that there will be changes to the U.S. health care, medical insurance basically system? Do you think so?
I certainly hope so. I think it's revealed the issues in the system in a way where people can't ignore them as we could previously. And hopefully, just like in all the other systems in the US, we can work together as a body and as also a generation to really work to ameliorate those issues.
And if you had to summarize the major differences between the US system and systems in other developed countries, how would you summarize it?
Yeah, that's tricky because the US system is really complex. It's a real mash of private and public ways to get insurance, but ultimately it just leaves a lot of people uninsured. Whereas lots of other developed countries have systems that ensure that each person can get the coverage that they need, and in a large way that those countries are doing is through a single payer system.
Mm-hmm. Other questions of Maya? From the floor, any?
I think Joel has one too.
Joel, go ahead, please.
We have a question. Yeah, I was just wondering, I wanted to ask, how feasible do you think it is that the healthcare system would be revamped or changed within perhaps the next year? Do you think, because personally, do you think that it'll take a long time, like a reasonable, a longer time before a whole a complete revamping of the system can occur?
Yeah, I think it's really tricky, and I think the U.S. also has a history of making pretty small incremental changes over a larger course of history. And so I would definitely agree with you in saying that it'll take longer than a year, and hopefully not much longer. And also we're still in the pandemic. So I think this is more of like a futuristic conversation saying, okay, once we've like gotten the rates down, once we're like all vaccinated, how can we address the systemic issues?
Other questions? By the way, the students at ALA are wearing masks because they're all in the same room. And of course, the pandemic is still underway there as it is in New York. So that explains that. The Hewitt students, I believe, are speaking from their homes. Also, we need to apologize because even though our Zoom subscription is for up to 500 people, apparently some people have been locked out as it maxed out at 100. And Lauren, my colleague, is looking into this, but let me apologize for any inconvenience this has caused. Any other questions of Maya before we go to Domina?
Yeah, I have a question. So with regards to changing the system, we know that COVID-19 has been impacting a lot of people. So I just wanted to ask, what are the stakes of, changing the system? Because right now, most of the healthcare system are focusing on either giving vaccines or treating infected COVID-19 patients. But there are other aspects of the healthcare that needs to be looked into. For instance, pregnant women, children, and other aspects. So, what are the stakes for those people? How are they being affected by this situation?
Yeah, no, I think you bring up a really important point and kind of the central point of public health, which is that all of these issues are interconnected and work in a system that is deeply flawed in the United States. And I think so if we redistribute the wealth towards public health, which is exactly as you said, like a collection of a lot of issues and covering many more people than just the COVID-19 patients or just another type of patient, that will ensure that we're better protecting everyone and everyone in our society.
Terrific. Thank you, Maya. And I would remind our audience that if they have a question, if anyone has a question, please throw it up there on the question and answer page, and we'll look at it as soon as we can. So with no further ado, we'll go to Domina in South Africa.
So hi everyone. Once again, I'm Domina Amara, and I'm a student at African Leadership Academy. I'm going to be discussing about the impact of COVID-19 on local education systems in South Africa. Like most countries in the world, learning in South Africa came to a standstill in March because of the lockdown. The closure of schools necessitated an alternative learning process, which meant transforming to online learning from the in-person learning situation. The pandemic greatly interfered with the education sector, both for students in the government schools and private schools, but also for those in university and those taking the tertiary education. Digitalized learning, okay, let's look at the digitalized learning technique after transforming to online learning. Digital learning being a popular alternative for learning during lockdown brought to light the inequality of accessing education among the diverse population of South African students. More privileged students were able to transform their mode of learning from in-person learning to online classes. This great divide rose many concerns for the students in rural life and with impoverished backgrounds. There were many queries like, what about the students who do not have access to internet facilities, who do not have access to data and laptops? And many queries were shunted at school and government as the expectations of some students were simply unattainable. The other part that I'm going to be talking about is the uncertainty among the student population. The outbreak of COVID-19 came along with the uncertainty among a great population of South Africans. With 3 million people losing jobs and others being forced to go back to their own provinces, led to the decline of production and financial gain. As a result, this posed a great risk on the education journey of some students. One of the South African students I got to interview highlighted the loss of a major breadwinner in the family, which caused severe gaps in the household and threatened his education. since most people weren't able to look ahead and like get this certainty of whether they'll make it for their further education. And the pandemic came with made the situation of marginalized students worse. For instance, the disabled students from the 39 special needs schools in Gauteng who required more hand-to-hand learning assistance faced the challenge during preparation for the final examination. Amidst the adverse fears of students forfeiting an academic year, there were also emotional disturbances that greatly affected performance of students in South Africa. It was a challenging year for South Africa and the world. The postponing and cancelling of learning programs, cancelling of final exams, closing of borders for international traveling also affected most South African international students. While most of my interviews acknowledged the difficulty the pandemic brought to them, some had contrasting experiences. I interviewed a South African high school student who shared about her experience that it barely disrupted her education because prior to the pandemic, she was already being attending to online classes and being homeschooled. Thank you, and I'm open for any question.
Another presentation right on the mark. Thank you, Domina. Questions of her? Again, I have questions, but let's hear from the students first. I guess my question, Domina, is those of you in South Africa, do you feel as if being there, you're better off than elsewhere in sub-Saharan Africa? Are there major distinctions by region or by country? What's the feeling there?
I personally feel like being in South Africa, the motive that drives me most is the fact that we came here with a purpose. Everyone has a purpose of leaving the home countries and being here. And I feel like, personally, I feel like South Africa is trying to take major, like following the protocols of the COVID-19, like wearing of mask and sanitizing, which I can say is quite different from what I expected and what I saw from my country. So I think it's quite safe, and I think it's okay, like to the fact that the threat is not to a great extent, and it's not bringing like major effects or like negative problems.
And you're currently in class in person at ALA, or are you hybrid, both at distance and in class?
We do the in-person classes whereby we all meet in a class, but there are protocols that have been and rules that have been put forward. We are social distancing, and there is sanitizers to make sure that everyone sanitizes. And before you either go to present or like use the things, they must be sanitized to us to ensure that there's no spread. And face mask wearing has been like something that is so common, like, and it would be weird for a person to walk around without a mask. So, yeah.
There's a question from the floor, actually. Are specific age groups being more affected than others? Domina?
So yeah, in South Africa, specific age groups are not like being affected. I would say it's spread variably depending on how exposed you are to the virus, or where you find yourself, or how abiding you are to the rules and regulation, or to the restriction with regards to hand sanitizing, nose masks wearing. So I don't feel like in South Africa specifically, specific age groups are being affected by COVID-19. It's all about following the restriction, staying safe, and obeying all protocols being put in place.
Another question from the floor, and I'll reword it just slightly, and that is, has the introduction of online learning in Africa been affected by internet access? Has that been a big issue? In many developed countries, it's sort of a given that students and workers can work from home because they have decent internet connection. Is that an issue in Africa or not? I know it's hard to generalize. Africa's huge, many countries, but for the sake of this webinar, can you answer that type of question? Joel?
Okay, I think I can answer this question. Yeah.
Sure, please.
So it's not an issue for most part. Most schools that decided to go online actually provided, or if it was not available, provided internet access for the students. So all people that have been attending online classes have actually been able to be fully committed to their classes, and it's been going smoothly. Actually, at early, we did our entire first term online. So we only just came to campus in January, and the first term was very successful. Thank you.
It was successful. Good. Good to hear that. So before we moved, thank you very much, by the way, Domina, and others. Before we move to Hannah, just if I could repeat what I just put in chat, and that is that even though our subscription at News Decoder is for up to 500 people on a webinar, people were locked out after 100. Zoom has told us that in order to have everyone on board, we would have to restart the webinar. We're in already 20 minutes. Unfortunately, we're not going to do that. I'm very sorry. We are recording this, and the best we can offer then is for those who miss out to be able to see the recording. Again, our apologies. With that, let's not waste any more time. We'll go to Hannah.
Hi everyone, my name is Hannah. Today I'll be discussing the impact of COVID-19 on hospitals in New York City and share some insight with my interview with Dr. Graham Barr, Professor of Medicine and Epidemiology at Columbia University Irving Medical Center. In New York City alone, there have been about 888,000 COVID-19 cases and about 30,000 deaths. In the spring of 2020, hospitals were overflowed with patients. Dr. Graham Barr spoke about how in March it was, quote, impossible for anyone to be fundamentally prepared. Hospitals tried to increase capacity as much as possible, but healthcare facilities weren't financially stable. Facilities that were already underfunded with fewer resources and staffing struggled to care for the significant increase in patients. Public health researchers know that quality and access to healthcare depends on location. COVID-19 only exacerbated this issue, as private medical centers in Manhattan with large endowments catered to wealthy people with insurance. Patients there got access to heart-lung bypass machines and specialized drugs, while in contrast, hospitals in lower income areas were denied more basic treatment due to lack of resources. According to data, patients in lower income communities were 3 times as likely to die from COVID as patients at medical facilities in the city's richest areas during the height of the pandemic. About 60% of patients who died from COVID-19 lived in zip codes with median household incomes. Manhattan has 16 confirmed cases for every 1,000 residents, while there have been 28 per 1,000 in Queens and 23 per 1,000 in Brooklyn and 33 per 1,000 in the Bronx. In the first 4 months of COVID-19 in New York, the coronavirus tore through low-income neighborhoods, disproportionately infecting people of color, especially immigrants and essential workers unable to stay home. The high rates of COVID cases in the New York City borough of Queens were attributed to underfunded healthcare facilities with lower staffing, worse equipment, less access to drug trials, and the fewest hospital beds per capita in the city. At Columbia Irving Hospital in Washington Heights, the surrounding neighborhood is one of the poorer areas of Manhattan and has massive racial disparities in who is affected by COVID-19. As Dr. Barr said, the reason behind these disparities become obvious. Quote, if you can think about who can extract themselves from the situation and leave the city, or effectively distance by staying in their apartments, by getting deliveries or telecommuting easily. COVID-19 highlighted long-standing systemic health and social inequities within our New York City healthcare system, which have put minority groups at increased risk of getting sick and dying. It's important to think about what we will do with this information. How can we strengthen our hospitals in lower income areas? And how can we make sure that New Yorkers all have access to health insurance? Thank you.
Another one right on time. Thank you, Hannah. Questions? I had one, but again, I want to give the students first crack here. Yeah, go ahead, Lauren.
Yeah, so Hannah, did Dr. Barr have any views on how you would address some of the disparities in how healthcare is delivered or who it reaches?
Yes, of course. I think it has a lot to do with funding because, like Maya talked about in her presentation, in New York City, access to healthcare has a lot to do with access to health insurance. So, and also insurance is very tied to employment. So as unemployment rates increased with COVID-19, as people lost their jobs, they also lost health insurance with this. So if we have more free healthcare for all systems, that will increase a lot of access to hospitals. And we also have to divert a lot of funding from private medical centers to public health centers because they have lack of resources to more basic treatments, while I spoke about wealthy hospitals with large endowments have so many drug trials and things like that that lower income areas and communities don't have.
Well, that's a solid and comprehensive answer. Thank you, Hannah. Maya, you had a question?
I just add something to that really quickly that I got out of my interview with Dr. Vassan. He was also saying that where hospitals are located is obviously based on how much money they can get from the surrounding neighborhoods, right? So if you have a hospital in a really wealthy neighborhood, the hospital itself will generate more revenue because it's like the people that it provides for, its patients, will have private health insurance, which means the hospital is paid more. Whereas if you have hospitals in lower income neighborhoods, they're more likely to use Medicare and Medicaid, which pays the hospital less. And so what that means is that more hospitals gravitate towards these neighborhoods of wealthy people, which just further exacerbates inequalities.
Mm-hmm. The fruits of a liberal economic system, right? I had a question, Hannah. You quoted Dr. Barr as saying that it was, as of March 2020, it was impossible to be prepared. Now, I'm not going to question his judgment, even if there have been many reports and studies done well in advance of the pandemic to try to get the United States and some other countries better prepared. My question is not looking backwards, is to look forward. Do you guys feel personally that, irregardless of what your governments may or may not do, but do you feel personally better prepared for when the next time a pandemic comes, because there will be another pandemic at some point?
I definitely think that we've learned a lot from the pandemic, especially about like inequities regarding geographical inequities and racial inequities, especially now that we know public hospitals are severely underfunded. And during COVID, a lot of hospitals actually put up tents outside of their facilities just to get more patients access to help and aid. So I think that we've learned that when there's going to be a significant increase in patients, we need to be able to have resources for that. So that means extra staffing or extra resources and things like that. Maya, if you want to add anything.
A question from the floor from Chris Riddick. If new rules or free healthcare plans were put in place, would they continue after COVID?
I think they would definitely continue. It would take policies. I think that's a lot what my interview talked about, is that we need policies to be implemented from the government, such as new healthcare plans. It can't really come from just doctors' point of view. We need like significant government support of it. So if we had a universal free healthcare system, that would definitely, of course, help if there's an upcoming pandemic, because everyone would have access to healthcare for free.
Other questions of Hannah before we move on to Clifford? No? Okay, well, I'm sure we'll come back to the US healthcare system. It's a topic of great interest, great debate and controversy. Clifford, over to you for your presentation.
Hello, my name is Clifford Hafner, Yolan student at African Leadership Academy. Today, I'll be presenting on the impact of COVID-19 on social workers and health workers in the Gauteng region in South Africa. COVID-19 has affected most people in most parts of the world, South Africa not being an exception. With regards to the impact of COVID-19, I'll be speaking on the impact on social workers in the Gauteng region, elucidating further on how it impacted the workers and the strategies that government put in place. The frontline workers in South Africa are at risk of experiencing physical and mental crisis as a result of the effectiveness of their job during these times. Mental health is a growing crisis across the globe, and health workers in South Africa are more prone to experiencing it. Because of these possibilities, one of the healthcare centers in South Africa, Netcare, has provided all its staff with flu vaccines at the company's cost to protect them against seasonal health risk. The government strategies with regards to helping COVID-19. They have helped the health workers in health centers by providing external and internal counseling service, providing self-isolation and other facilities to support the system. They've also helped over 1,138 health workers with accessing the vaccine. As pressure mounts, hospitals, both private and public, are using external service providers to offer therapy in the form of counseling and psychological support for healthcare workers. Dr. Stefan, the Chief Clinical Officer of Mediclinic South Africa, said that the group has also taken steps to help nurses in particular cope with their workloads. Operational priorities of nursing staff particularly have been relooked, with tasks removed that are not core to clinical care delivery at this time. Staffing structures and quotas have also been reviewed to ensure safe staffing while providing facilities to the outside world. However, it is important to note that we are at challenging times. Therefore, health workers also have constraints with regards to accessing facilities. From an interview, I learned that one of the health workers have to use one glove for over 6 to 8 patients per day. As a result of this, they have to go the extra mile to accessing facilities like gloves to provide for themselves. In times like this, it is important to acknowledge the good work of these health workers providers who continue to risk their lives every day to support the people of South Africa and the world at large. Thank you.
2 minutes and 56 seconds. Another astounding keeper of time. Thank you, Clifford, and also very interesting presentation, including that eye-popping statistic of one glove for 68 patients. Anyways, questions of Clifford? Yes, Maya.
Well, this is a little bit of a silly question, but in many cities of the United States, including New York, and I also believe the UK, citizens are like celebrating healthcare workers and other essential workers at like 7 p.m. daily, or like just giving them a little like clap. And I know in the last part of your presentation, you were saying it's important to celebrate those. But I guess I'm just wondering, are there any ways that people celebrate those people in South Africa?
Yeah, there are ways in which people celebrate health workers in South Africa. For instance, in our School African Leadership Academy, health workers have access to incentives that encourage them to continue working, and they have support system from the school. So counseling, physical therapy, providing support in the fund in forms of fund are also ways in which the government and its people are supporting health workers in South Africa.
Yeah.
Yes, please go ahead, Hannah.
I had another question. I was wondering if there was any disparities between public and private hospitals with getting more funding than others.
Well, in times like this, I wouldn't say there are disparities, but the government is trying as much as possible to ensure that all the needs of the people, both in private sectors and public sectors, are being met. So they're doing this even distribution that I know of in the Gauteng region, wherein public workers in hospitals or public hospitals have access to a particular fund with regards to a month time frame, and also private sectors also have these facilities, and also private sectors have access to self-donors, which help in maintaining the support system provided in the hospital.
Maya, I noticed your comment about people clapping at 7 p.m. and that used to happen in Toronto, and now where I live, and it's since stopped. Has that kept up consistently throughout the pandemic?
I wouldn't say consistently, but there have been like, at least in my experience, there have been like pockets of a really intense like celebration, and then right now we're not in one of those. So.
And is life getting back to normal in New York City with more and more people getting vaccinated, or does it still feel pretty much the same as before?
I mean, I think it feels a lot more normal, especially like as it gets warmer, you just see a lot more people outside. I would definitely not say it's like completely back to normal, but on getting there.
I had a question, and that was whether students, I mean, Clifford alluded to the shortage of medical equipment at times during this pandemic in various parts of the world, in fact. My question is whether you guys would be willing to pay higher taxes to make sure that the next time there's a pandemic, there'll be adequate equipment. Does that mean no, you students wouldn't want to pay more? It should be left up to individuals to buy, or should the public purse be augmented through taxes?
Could I
Joel?
answer?
Yeah, please
Yeah.
go ahead.
So I like to look at this from a different angle. I think the reason there is scarcity is actually because the production lines are stretched rather than people. It's not like people don't have the ability to pay or hospitals are not able to pay. It's just production lines are stretched because I don't think most of them ever anticipated such. So I don't think there is. I don't think I would like to give an answer to your question. Yeah, but rather assume that next time, or and maybe in the coming month or a year, that production lines would have expanded to be able to meet demand. Thank you.
You're welcome. Thank you, Joel. Let's move on because we're want to make sure everyone has an opportunity to present. Let's move on to Sadie, back to New York. Sadie?
Yes, so my focus was on arts, entertainment, and recreation sector of New York City, but specifically looking at the smallest subsector, museums, parks, and historical sites, which make up 15% of the whole. In March of 2020, in response to the health crisis of COVID-19, the entire sector was forced to close. And data shows that the arts and cultural community was hit particularly hard by the pandemic. So from July 2019 to July 2020, there was an overall 69% decrease in employment rates. Prior to COVID, nearly 293,000 workers in this community provided the majority of the revenue supporting New York's economy. So as a result, looking at museums, that sector alone lost almost 34% of its jobs due to closures, and art employment in New York City dropped by 60%. So around like 50,000 people lost their jobs. So not only did the city's artists, actors, musicians find themselves unemployed, but many reported the feeling of devastation, of disconnection with their communities. So as a form of expression vital to not only community, but to the economy, it is evident that the emphasis on not just art connection, but human connection is essential, and even more so during a pandemic. So along the 5 boroughs of New York City, household institutions such as the Metropolitan Museum of Art, the first museum to shut down on March 12, 2020, the Museum of Modern Art, the American Museum of Natural History, and the Bronx Zoo, just to name a few, struggled with a dramatic decrease in revenue flow and lack of a support system. And so these shutdowns trickled to small gallery owners and to the living artists who found jobs and paychecks. So it is vital that art is preserved. From what I've gathered and beyond my investigation is that implementation and flexibility is essential. So the health of the community not only depends on its economy, but the connections members make with each other. Art in public spaces and marketplaces bring people together, increases civic participation, and deepens a community's bonds to rise up together. So what I observed here in New York City is the power of public art and creativity in showcasing art form. So in conclusion of the question for ALA, in your opinion, what are the ways in which artists and galleries have kept art relevant in Johannesburg?
Okay, interesting conclusion. Tossing the ball to ALA, well done. I like that. So you want to repeat the question, Sadie, so ALA students could hear it again?
Yeah, in your opinion, what are the ways in which artists and galleries have kept art relevant in Johannesburg?
Who are the art goers there? Clifford, Domina, Joel?
Okay, so what has actually happened here in South Africa is for most parts of the COVID, the pandemic, um, the country has been like at the high alert, so movement has been restricted. But in the past month, I think last month or 2 months ago, we actually got back to tier one, and now people are able to move around, and there's no longer a curfew. So as a result, people have started revisiting art centers, museums, but only within the last month. Before this, most arts appreciation was actually limited to most people were limited to their rooms and their houses, so art appreciation as well was limited.
So museums were closed, for example? Joel?
Yes, museums were closed actually.
Yeah. So it's only been recently that they reopened, a real hit, yeah. There's a question from the floor. Christopher Riddick, by the way, is our #1 questioner. Thank you, Christopher. Do you think the loss of jobs in the arts could be a reason for many COVID cases because of a lack of healthcare for anyone that may have been laid off? Is there any link between cases of COVID and the straits that the arts are facing? Do you know, or maybe not?
No, yeah, I mean, I think that obviously there being a lack of an art system, I think that is impacting people. So then when there is something that's opening up, there's kind of like a frenzy a little bit. And so people do tend to kind of gather, and that does impact the cases. But I feel like generally there's been a lot of like control surrounding that aspect in terms of like when our gatherings, when can people come and see these art galleries and stuff like that. So it's kind of case by case basis, I would say.
Okay, great. Let's go over to Joel then with your presentation. Joel?
Yeah, thank you. Okay. Hello everyone, my name is Joel again. And today I'll be presenting on the impact of COVID on the mining sector, employment and productivity in the mining sector. Have you ever considered what metals form your laptops or PC? It's likely that the copper, gold, aluminum, zinc, or iron that was used to manufacture it were mined at depths up to 4,000 meters somewhere in South Africa. It's simply incredible. South Africa is among the world's leading producers of a host of minerals, from platinum, gold, and much more. It's no surprise then that the mining sector contributes to 8.1% of the country's GDP, which according to latest numbers from the Mining Council is about 361 billion rands, $25 billion. And it also provides over 450,000 jobs. Nevertheless, the productivity of the South African mining sector had already been on a decline before the advent of COVID. Data compiled by BCG South Africa between 2010 and 2018 suggests that those years saw a 10% loss in output with a 45% decrease in annual capital investments. One of the reasons for this was because of inconsistent energy supply in the nation. Load shedding alone had caused mines to lose up to 30 days of work hours in 2019. Secondly, South Africa's mining industry is very labor intensive, which decreased their competitive advantage to other producers worldwide, compared to other producers worldwide. Furthermore, the 3-week lockdown imposed on mines last year meant that processing lines were at some point completely static. Most of the reasons for this decline were further amplified by the effects of COVID, as further load shedding occurred, while the lockdown in the nation meant that productive hours were cut down drastically. What about the effect on employees? To start with, around 60% of the workers in the mining sector in South Africa are contracted workers. Hence, in situations like lockdown or leaves, they are not paid. During the lockdown, Reuters reported that around 100 zamazamas, a Zulu expression for taking a chance, were in the mines illegally in the Gauteng region during the lockdown. These miners had no choice but to stay and work. According to a lawyer representing them, I quote, now they have to face a question. Do they die of hunger or risk getting arrested for violating COVID-19 regulations? Like them, many of the unemployed, many of the other unemployed workers have to face similar difficult choices because of the pandemic. Mining is one of the more significant contributors to the South African economy. It remains so despite the effects of COVID. Hence, a deeper investigation and response to COVID and non-related issues pertaining to it will be significant to the overall recovery of the economic situation in the country. Thank you.
Terrific. Thank you, Joel. Lots of sectors have been hit hard by this pandemic, but not all. That's always a lesson in these kind of crises. There are always some sectors that actually benefit, come out pretty well. I think we know what they are, Netflix being one of them, of course. Questions of Joel? Yes, Maya.
So how does the general public respond to the issues in the mining industry? And I'm thinking particularly about like employee rights.
The issue actually is a lot of the workers in the mines are immigrants, so they're immigrants from like neighboring countries. So a lot of them actually do not belong to trade unions. So because they don't belong to trade unions, it's hard for them to have a collective voice to push motions in like the parliament. However, I think one of the blessings, permit me to say, of this COVID is that now I think I've read reports that a lot of these immigrant workers are actually joining trade unions now, and to be able to protect themselves if such events happen again.
Question from the floor for you, Joel. Has a slower product, by the way, this comes, Christopher Riddick, I didn't know this, but Christopher Riddick is relaying questions from the 8th graders at the Hewitt School, which is fantastic, thank you. Has a slower productivity rate affected the economy so heavily that it will not come back to normal by the end? In other words, will the economy be able to rebound after this?
Yes, I think I understand that question. Yeah, so I've reports from the mining council of South Africa, which is like a smaller section of the parliament, actually just put out their reports for the year a month ago, and they expect that within 2 years the sector will be back to normal. But it's tricky because the sector was already in a decline over the past 10 years, like slight decline. So it will be hard exactly to gauge where it would fall, whether a decrease in output at maybe in 2022 will reflect a decrease in productivity, or maybe it was just following the trend. So that becomes dicey for the economists to gauge.
And another quick question for you, Joel, before we move to Aaron. From a student, how are the miners doing now? Are they slowly getting back to work or moving to other jobs? Good question.
The miners actually getting back to work, and the mining sector actually, most of the companies have actually taken it upon themselves to provide amenities for the workers now, and even for the communities they're around. So most of the miners are actually back in their jobs now.
All right, great. Let's move to Aaron then.
Wait, a question or my presentation?
No, either one. You got a question? Yeah, you have your hand raised. I see. Please go ahead.
I'll quickly ask one question. I read about South Africa trying to make their mining industry more green. I was wondering if COVID has set this back at all.
Yes, it has, because even one of the reasons why the sector had already been on a decline was because it was labor intensive, and I think in general their technology inclusion in their minds were actually limited. So I imagine that the government and the mining sector would actually focus on recovering, stabilizing first before looking to move towards green. Yeah. Thank you.
You're welcome. Thank you, Joel. Aaron, over to you for your presentation then.
Hi everyone, I'm Erin and I'm going to be presenting about the impacts COVID-19 has had on the incarceration system and the incarcerated. So COVID-19 hit prisons like a brutal storm. There are rampant outbreaks nationwide, and so many prisons responded by implementing various policies and executive orders. However, the harsh reality was that prisons were not equipped to handle a pandemic. In July of 2020, researchers found that prisoners were 550% more likely to get COVID-19 and 300% more likely to die from it. So in efforts to reduce infection numbers, basically everything was just shut down. What this meant for many prisoners was 23 and a half hours behind bars each day, meals were delivered, elective medical care and dentist care is postponed, vocational, religious, and educational meetings were all stopped. So basically any sort of little social interaction prisoners previously had was gone, creating a sort of double isolation as prisoners were already in a pre-existent state of separation from the general population. The pandemic has turned incarcerated life completely upside down. I'm at the lowest point hope-wise of my life, says inmate James. When a prisoner does test positive, they are placed in medical isolation, or in the words of several prisoners, segregation. Segregation is a dark, dreary place and no one wants to go there. Segregation is devoid of everything that we hold dear. Segregation offers no measure of comfort, says inmate James. So a positive impact that I want to highlight that the pandemic has had on the incarceration system is the movement for decarceration in the US as increasingly gaining support. So with prisons being hotspots for COVID-19, officials found themselves reviewing inmates' cases to see if the individual truly needed to be locked away or if there was an alternative solution that would seek justice and punish appropriately without the trade-offs of compromising one's health. So in New York City specifically at Rikers Prison, where infection rates were through the roof, the Mayor's Office of Criminal Justice Reform reached out to advocates and organizations to see if any were willing to help. The Exodus Transitional Community Center was one of these. And so 3 reentry hotels were set up in Manhattan and Queens with security stationed by them to monitor the early release prisoners, and wraparound services were provided. So despite backlash from some local community members, the program continued and it was found to actually be very successful. Zachary Katz-Nelson comments that those folks did as well were better than people that got out of Rikers who didn't have those services. So this new program that the pandemic somewhat forced upon New York City could potentially become the new norm for or basis of a new criminal justice system where we provide not only needed services to prisoners when released, but also a second chance. People are often revolving doors of incarceration for low-level crimes and tend to struggle with mental health. And so by creating a system that is not just releasing prisoners to the streets with no support, we can have a decrease in the incarceration rate and a system that is much more cost efficient and much more just. Thank you.
Terrific. Well done. Right on time again. I'm very impressed. I can't resist a question. Others please follow, but are you confident that this will put wind in the sails of those who would like to have fewer people in prison in the United States through the legislative process? Do you see work being done on Capitol Hill and in state legislatures to try to reduce the number of prisoners based on the experience with COVID?
Yeah, so for a while, the US has had the lead and the highest incarceration rate globally by a significant margin. It's knowledge officials knew about, but it's really this pandemic that has actually had conversations about, taking action being surfaced amongst officials. And so we're seeing many lower officials like city council people and stuff like that start to introduce criminal justice reform. And there's a lot of programs that seem very promising. And there's also a lot of organizations that came out of this pandemic hoping to advocate about the criminal justice system and change it for the better.
Wouldn't that be something if this pandemic actually did something about the high incarceration rate in the United States? Question from the floor for you, Erin. Has the restricted interaction in prisons caused more anger or riots?
Yeah, so recently there have been a lot of prison riots and definitely anger. There's also issues with well, not issues, there's also protests about recent, police interactions that have generated a lot of um, riots and just anger from the general public. And we've also been seeing this in prison. So there's a lot of anger, but it's also important to note that there's somewhat of an increased anger when you're locked in a cell and you're set away from the general population, and to be experiencing what the US is angry about in criminal justice reform, but also be experiencing it yourself.
Something which the ALA students may know, but perhaps they don't, but a very high proportion of prisoners in the United States are actually Black Americans, much higher proportion than they constitute within society in general. It's an eyesore, I would say. Other questions of Aaron before we open it up to sort of general discussion?
Yeah, I have a question.
Please.
The question for Aaron is a follow-up question to the one that was just asked on the floor. So it's with regards to the offices, like in those confined areas, like what's the security system that have been put to safeguard their own lives with regards to the riots and the other societal acts being happening inside the prison. And also the other question is with regards to crime rates outside the city, do you think or that the current state happening within the prison is affecting the crime rate in the United States? Are more crimes being committed, or has it led to a decrease?
Yeah, so there's definitely we are at the lowest incarceration population right now. I think in New York City, we're at the lowest incarceration population since around 1950. So it's very low. So yeah, so for that question, yes, we've seen a huge decrease also just because people are forced to stay in their homes, of course. And then, sorry, I'm trying to remember your other questions.
I said the security structures being placed for staff, like the officers themselves.
Mm-hmm. So in these reentry hotels, they have security stations at each one monitoring them. So they have certain times they have to check in, and they have security systems with, the metal detectors as well. So, and in the hotels themselves, they're not open to other guests. So the hotel is it's the prisoners, kind of to say. And so, yeah, there's times you have to check in. There's increased surveillance in the hotels as well. Yeah.
Just a last question from the floor for you, Aaron. From a student, why do you think society responded so slowly or poorly to the outbreak of COVID in prisons?
Yeah, it's a great question. I think just because prisoners are the most disregarded people in society among us. We don't tend to pay much attention to people that are set aside, people that have broken these rules that we've enforced. So the main focus at first in the pandemic was most definitely not prisoners, and it was upsetting because prisoners had the biggest outbreaks nationwide. So what this pandemic has done is really shown how healthcare, the medical help there, the just overall sanitation system, and how poor it is in prisons. And so I think that as the pandemic continued, we started almost humanizing prisoners more. But at the beginning, there was definitely not that sense of sympathy with prisoners.
Terrific. We've got 1 minute left before the top of the hour, and we always run these things right to the minute. So anyways, any other questions of one another on any one of your presentations or any topic? Any comments you'd like to make about COVID-19 in general? Yes, Domina.
Thank you so much for this opportunity. So I had a question, like for the economic activities or economic sectors which have been facing losses, is there any way that the government is trying, mostly the government-led institution, is there any way that the government is trying to compensate the losses that have been incurred during the critical COVID situation in 2020? Yeah, do you get the question? I hope it's clear.
Yes. Hewitt students?
I can start to answer this question. The US government sent out stimulus checks to a lot of people who lost their jobs. So that definitely made up for a lot of the unemployment. And anyone else can also add on from here.
Yeah, Maya.
Also, Joe Biden just passed his infrastructure bill and plan, which involves a lot of, obviously in the name infrastructure, but a lot of economic reforms that a lot of Americans have been waiting on for a while now.
I think they've introduced that bill. We'll see what, how far it gets through Congress. What they have passed is a $1.9 trillion aid package for a number of sectors and also individuals with checks, no matter whether or not you're employed. Well, Erin, you wanted to say something.
I was going to kind of just repeat what you said, and that yeah, there was a huge increase from the first stimulus checks that got sent out. And so the Biden administration really wanted to make sure that they had more to give rather than just enough or not enough. And so because of those stimulus checks, I feel that, yeah, I think we're going to see a good increase in the economy in the US.
That's a good question, Domini, by the way. Yeah, I mean, in general, the US government has thrown a huge amount of money into the public because of COVID. It's not targeted quite as specifically to industries as in some other countries, and a lot of it has gone to individuals, regardless of whether they're employed or not. But the bottom line is that there's a lot of money washing around out there, which explains in part why stock prices are at record highs, and why the morale in the United States, in addition to vaccination moving ahead pretty well, is because there's quite a bit of money out there. Anyways, we're actually past our time here, so this has been an absolutely terrific job. I don't think we've ever had as professional a group of students present as we did today on a very difficult topic. Thank you very much. Thank you for your questions. I want to thank those who were not on camera, who were very interactive with us with their questions. My apologies again for the cutoff at 100. We don't have an explanation for it. We are recording this, so if it's any consolation whatsoever, those who did miss the live session will be able to see the students from their school do as good a job as they did. Lauren, what have I missed here? Lauren, you're still muted.
Thanks. Yeah, no, just want to second Nelson and saying congrats to everyone. You're really professional, brought such good expertise to the fore. So thank you all for showing up and participating. Yeah,
professional in the sense that your presentations were absolutely right on time, which is great. Excuse me. But moreover, you did research. You did original research, which is something that we emphasize at News Decoders, that you can not only understand the issues, but be unique and distinctive, because it's easy to cut and paste from secondary sources like newspapers and magazines and news websites, right? Anyone can do that, but to actually go out and interview people and to dig into data and to find original material takes that little extra effort, and we appreciate that. So anyways, thank you very much. Congratulations to all of you, and thank you for supporting News Decoder, and wish you all a very good day wherever you are. Thank you. Cheers.
Thank
Bye-bye.
you.
Thank you.